We are joined by Dr. Eugene Lipov, author of the book, The God Shot, Healing Trauma. Thank you so much for being on our show and welcome in. It's a pleasure to be in conversation with you. So talk to us. What is the God Shot? What does it all mean?
Thanks for having me on. So the God Shot was a term actually that was coined by a Marine. So I came up with a procedure called stellar ganglion block, and it seems to take away PTSD symptoms about 5-10 minutes. So a number of military people have been treated with that. So one of them was treated, and he called it the God Shot because it changed his life. So the only entity that can change lives is God. That's why he came up with that name. And then there was a Playboy article actually with the same name, one of the patients I treated.
So why did you feel this treatment deserved an entire book?
Well, we've saved a number of people from suicide at this point. I've personally treated about probably 4,000 people. And the big thing I'm trying to propagate the information is that PTSD is actually a physiological, real condition. So people call it the invisible wound. My point is it's not an invisible wound if you have the right scanner. If you have the right scanner, then you can actually see it and you can treat it physiologically. And if you think about conventional therapeutics, how effective they are, you're looking at 40% therapeutic efficacy, which is psychotherapy and the medications. My procedure I came up with now has been replicated at a number of other institutions. There's a large study coming out this year showing how effective it is. It changes lives. And then the reason I'm so passionate about it is my mother took her life when I was intern in surgery.
So sorry.
And then, thank you. But I'm doing something good with it. That's why I actually feel good about it. But I think explaining that it's possible to treat mental disease as a physical disease is a big concept. And it's really not a particularly long book. I think it's beautiful.
The God Shot.
The point is, the point though is it's very important for people to know there is hope. Because nobody takes the life if there's hope. And there are treatments available. I'm currently a chief medical officer for Stella Mental Health. We have sites in 24 places in the United States, one in Israel and four in Australia. And I think this is going to be a big deal this year. I've been working very hard to promote this information that it's possible to treat PTSD successfully. If you look at the story right before me, that family is going through hell right now. It's very difficult. So I always say I cannot stop the craziness, but hopefully I can help pick up the pieces. That's what we're doing.
And you've said that trauma leaves a physical imprint really on the brain and body. So what does that mean?
So, for example, when somebody sees a friend or somebody like that gets injured or whatever, some other horrible things happen, part of the brain called the amygdala activates. That activates interleukin 6 or the immune system, and the immune system now starts to damage the body. People who have PTSD, for example, have a heart attack at twice the rate, and there's other physiological changes. There's a new thing people are talking about, genetic disease. Basically, watching memes too many times, it leads to mental disorder, but actually mental disorder causes physical disorder. People have more immune system, likely increases the chance of cancer, definitely increases heart attack chances, increases strokes. So mental disease is not just mental, it actually has physical effect. And we are trying to reverse that. Turns out stellar ganglion block, the procedure I came up with, reverses the immune changes, which is amazing to see.
And the treatment also targets the stellate ganglion gland, so the nerve, excuse me. So can you explain what that means and why it's important?
Yeah, so basically, the fight or flight nerves stop in the head, in the brain, go down the spinal cord, come out the spinal cord. The nexus that controls it is in the stellate ganglion, which is called the ganglion, which is basically where the nerves come together. From here, those nerves go up to the brain. So what happens when there is severe trauma? Extra sympathetic nerves grow. Let's say there are 4 usually in the head. After trauma, now you got 8. Each one of those nerves pumps out norepinephrine. Norepinephrine is like adrenaline. if you almost got hit by a bus, you're all wrapped up. But if you're always wrapped up, that's very hard on the body. Hence sleep, sexual dysfunction, all the other problems. So it turns out when you numb up the nexus here in the neck, that stops it. So in about 5-10 minutes later, people feel significantly better. But it also takes away the extra nerve growth, so extra wires in the brain go away. So block that lasts 8 hours can last 20 years.
I know you've called it the God shot. So how does this particular injection improve or reset the body's stress response?
I don't know. So it turns out there's a connection from the stellate, the nexus, to the thymus, which controls T cells, and bone marrow, which is B cells. That's the immune system. So when we reset the whole story, the whole system, the immune system goes back to normal. And then people can now sleep normally. Sleep also changes the immune system, increases blood pressure, all the other downstream effects. And then if people can be calm and not overreactive, their family relationships improve. All of that comes trickle down. When they're calm, their immune system and digestive system work normally how it's supposed to be. So that's what. Go. I'm sorry.
No, sorry about that. So you would call this the God shot if somebody wants to get this. And we talk about different disorders. Is this just for PTSD, or can it also be used for people who have different disorders like anxiety?
Well, anxiety and PTSD to me is the same thing. It's very hard to have PTSD and not have anxiety. The first time stellate was ever used actually was for pain. I'm a pain physician. That's why I know how to do those procedures. It was 1925. My father was born in 1925. Was for pain in the hand. But originally, again, it was primarily pain in the hand. Then I published a paper in 2005 about using this to treat pouch flushes. That seems to work very well for that, especially for women who cannot take estrogen. So it works for that. It seems to work for ulcerative colitis, which has abdominal pain. It has a lot of other applications. But the biggest application we use it for is PTSD, also post-COVID syndrome. We published on that in 2022.
And how quickly do patients feel relief after getting the injection?
That's the best part. 5-10 minutes later, people can take a deep breath. They have a huge joy in their face. It's just pleasure to see that. So response, not in everybody. We have failure rate of 40%, but it works almost immediately, which is amazing, and it can last for a long time. Longest outlier right now is 17 years.
So I want to ask you, I know that it's great to get on medication, but at the end of the day, shouldn't patients try to solve whatever they are challenged with or the demons that they are battling with therapy or maybe some physical movement rather than relying on just, getting the shot?
Well, if I may push back a little bit, I don't think it's great to get a medication at all. But as far as the current psychiatric medication plus psychotherapy is about 40% effective. So I agree. So it depends how severe it is, right? So if somebody has mild PTSD and people get massage or do yoga and they feel better, that's great. But if people cannot sleep, they cut their vigilant, and people say, why can't you not just snap out of it? I did a TEDx talk in Mexico actually 2 weeks ago. That's one of the points was you could not snap out of PTSD because you have extra nerves that have grown inside your brain. You cannot come out of it, right? So keep in mind, the great thing about my approach, you do an injection, you don't have to keep taking medications. So all it is, you're trimming back or pruning the extra nerves, and it gives you a normal life. That's what I'm talking about. Conventional psychiatric medication you have to take for years, and they have a lot of other side effects associated with it. This has been done since 1925, and you don't have to keep taking it. That's the best part. You're actually fixing your autonomic nervous system.
So what does the research show so far about its effectiveness? I know you said it's fast, but is it actually helping people?
Oh, well, I can give you a specific example, and you can tell me if you think that's helpful. How's that?
Sure.
I think that'd be the easiest way to do it. So we took care of a 10-year-old child that's been suicidal for 5 years. I just got a letter from her mother, this is 3 weeks later, that she's no longer suicidal, she's feeling great, and she can sleep. That's success to me, especially in pediatric. And we have a number of stories like that, where people can sleep and It's the spouses report that they can get their spouses back, and the temperature in the house is much lower. So our success rate, about 75 to 85%, depending on publication. Other people have replicated that. They've seen similar results because, again, the compliance is very high. People come in, it gets done, and there's a good response rapidly.
Yeah, that's a great story and so encouraging to hear about that case in particular. Were there other cases where you saw that therapy was not working 100% and this did?
Yes, I can give you a specific example that stands out. Our partners in Australia had a patient that's picking up dead bodies. His work, not mine. He was a policeman for 5 years. He was in treatment for 5 years. His psychiatrist, he was also his psychotherapist. No progress. He was suicidal. He lost his wife, his family. It was a complete disaster. He gets the block. 2 weeks later, he's a changed man. He's markedly better. He was able to come off half his drugs or medications. The reason that happens is during psychotherapy, you need to be able to talk about what the issues, but the problem is you cannot talk about it if you're wrapped up. Like men get very angry when you face some big problems in their heads. Women shut down and cry, but you cannot make any progress. And that's the issue. Because here is the autonomic nervous system is what's overactive. And if you can calm it down, the success rate is so much better. So our best success is when we can calm down the fight or flight nervous system. People do psychotherapy for a couple of months, and then I think we come up with medications a lot of times. Not necessarily all of it, most of it. Also, they can sleep through the night. For those people who have PTSD, lack of sleep and nightmares is a disaster. They can never rest, and it's very consumptive of the body.
How do you respond to people that are skeptics and they think that this is too good to be true?
Well, proof is in the pudding. I gave testimony about in 2010 in U.S. Congress. And again, it's been replicated in a number of people. And if you think about it, I've had a lot of critique over the years. It's much, much less now. There was a study that published from Fort Bragg, which is Special Forces, and came out in JAMA, which is a big medical publication. There should be 2 studies coming out this year. You know, the results are there. And then it makes sense because it's physiologic. The main critique has been that it's so weird, right? People are used to taking a pill and talk about their problems. But it also makes sense if you're wrapped up continuously, if you can do something about it, that should work. But, it's like there's always skeptics. There's always people who don't believe it. And there's a lot of special interest groups who are interested in not having that be available.
What do you want to say to people who think that they're carrying unresolved trauma? What is the first step that they should take?
Well, first of all, if you go on the web, you can put in PCL5, PTSD checklist. Do your own assessment. If you're about 45, you probably have PTSD. If you cannot sleep, if you have overreactivity, like something touched in the shoulder, you feel like whacking in the head or crying, and impulsivity, things like that, those are signs of PTSD. And a lot of people remember, especially childhood trauma is particularly problematic. If you do have that, you've tried other things or you haven't tried anything, do your own research, review it. There is a lot of publications. My website is dr.eugenelipov.com. Read all the publications that I've written and other people have written. There's a lot of stuff on YouTube that I put out and other people put out. But the key point is hope. Again, my big thing is prevent suicide because of my mother. If there's no hope, then that's when problems happen. Our suicide is spiking, including preteens. It's the number 2 physiologic cause of death in preteens, which is spooky to me. That's a very spooky number. So don't give up hope. There is options. There are other treatments besides stellate. TMS, which is electrical way of doing it. Ketamine seems to work very well for depression, things like that. But look at other things. If your medications haven't worked and psychotherapy hasn't worked, try something different, and sooner than later.
Absolutely. So when we think about getting off of this God shot, correct? What are the side effects if somebody wants to get off of it at some point?
Even if they want to receive the procedure,
No, but if they want to get off of it.
get off the injection.
Yes. Like stop,
Oh, well,
once they stop taking them, is there something that happens?
Oh. I understand your asking. I'm so sorry.
That's okay.
It's not a medication like that. So basically, when you do an injection, like the longest outlier right now was 17 years ago. He had one injection. You don't just keep doing it. You do a couple, and that's it. It's not like you don't get hooked on it. The medication we inject is called bupivacaine. That's the medication that's used for pregnant women during pregnancy. You're just numbing it up. It's not a drug that you're going to have withdrawals from. Absolutely not.
If you're numbing something up, isn't that something to do with the drug?
Well, if you go to a dentist and they numb up your teeth, that's what we're doing. Same thing, only we are doing it to the fight or flight nervous system. Does that make sense?
Okay, yeah, that makes sense. Where can people find this book if they want to read it? Can they listen to it? Where is it available?
It's going to be available on the 17th of February, very soon, a couple days. There's an audiobook version and there is a print version. I also have it available in Spanish. Sorry. But I think there's a lot of education in that and it's extremely well written. My writer, Lauren, did a beautiful job in it. She took science stuff and made it very easily palatable. I think people really understand it.
All right. Well, thank you so much. We appreciated that, the God Shot, and it was such a great conversation with Dr. Eugene.